today what we're going to be looking at is just some conversations around general mental health, how to maybe recognise those early warning signs in ourselves, and a few wee tips into how to actually engage in conversations with other people. It's normal for your mental well-being to fluctuate even throughout a day. The main thing to look out for is if you find that those wee dips are starting to last a wee bit longer, or if you find yourself again, hobbies, interests, socialising, exercise, and they tend to be the first things really to go. That's probably going to be a good indicator that we've started to dip into maybe poor mental well-being rather than just having a bit of a bad day or a bad few days. Some signs you might see in somebody else might just be like their general upkeep of themselves or general self-care. You might notice that they're a bit more lethargic, maybe even a bit more irritable, a bit tetchy, things like that. Another example might be colleagues at work. If they start to turn up late, which is quite unusual for them, or maybe the opposite, actually overworking and staying quite late, you might notice changes to the quality of their work as well. Those could be key indicators that someone at work is maybe struggling. Some of the things that you might be able to say to somebody to check in might just be a wee kind of comment to some of the changes you've noticed. Just saying things like, I've noticed you've not been coming out as much, is everything okay? I've noticed that you've been staying on late at work. I've noticed you've been a little bit later than usual. Just really addressing those changes and giving them the space, those kind of open questions. The best way really to show that you're listening is just making sure that you kind of appear to be engaged, and it's things that you normally do anyway. It's things like nodding your head, making sure you're giving the person eye contact as well, making sure you're not being distracted by your phone or other things going on. I think another key aspect when having these conversations is just to normalise the experience the person's going through. Some other things that can be helpful just for your own understanding and to again show that you are paying attention to the person is just reflect back what they're saying. Again, what that also does is it gives the other person room to correct you. If you maybe have misunderstood something, it lets them say, actually, it's not quite frustrated, I'm actually pretty annoyed about this thing. And those small differences are just going to really help the person feel that they are being listened to. So it's really important when we are supporting other people that we do also let them know where those boundaries are. Our goal here is just to be a supportive friend, family member, colleague, whatever that is. It's not about actually becoming somebody's therapist or counsellor. You're not there to fix the problems they're facing. You're just there to be someone that they can go to whenever they feel like they do need to maybe lean into somebody. Best thing to do in all of these situations is actually just check in and ask, where do you really need me at the moment? What do you need me to do? It helps the person see that this is actually a genuine support rather than someone just checking in because they feel that they need to. Ultimately, if people feel that they do have that support around them, they're a lot more likely to engage with other services that are only going to benefit them. Hopefully now you feel a little bit more comfortable being able to spot those early warning signs in yourself, but also being able to spot those early warning signs in those around you. Ultimately, again, it's just making sure you are checking in with yourself, checking in with other people, and making sure that you are kind of falling in line with your own values, taking the time for your own self-care, doing the hobbies, your interests, those things that give you fulfillment. That's always going to be the best way going forward and providing yourself with the best mental health you can have.